Okay, so I've got some fun questions. So do you think there is life on other planets?
Do I think there's life on other planets? Scientifically speaking, yes. I would say the probability of there being life on other planets is likely. Do I think we're ever going to see it in our lifetime? No. At the same time, I also don't think there's a huge possibility of us ever actually running into alien life or life in general outside of planet Earth. Even though the math says that it has to be out there, the math also says that our chances of finding it and seeing it aren't likely.
What weird food combinations do you like?
Weird food combinations do I like? I'm told pineapple on pizza is pretty weird. I have tried sour worms, like the little lollies, and you dip those in like tzatziki garlic sauce dip, and it's actually quite nice. Or French onion. It's good with French onion. I don't know how I figured that out.
Oh, that's okay. What is your cure for hiccups?
Wish I knew.
Yeah, okay.
At the moment, I'm getting a lot of hiccups all the time, like consistently. In the old days, I would say the cure is just burp, swallow some air, which sounds weird, but try and swallow it rather than breathe it, and then burp.
What is your favourite sweet treat?
Favourite sweet drink?
Sweet treat.
Sweet treat. Probably have to go with pancakes in various forms. A bit like my brother. I wouldn't say they're my favourite, but they're probably the most common and easiest thing to make, so I guess that's what I make.
Okay. So pineapple on pizza, yes or no?
Definitely yes.
You kind of answered that one already.
Yeah.
What superpower would you like to have?
Teleportation.
What have you found on the ground or the side of the road? Have you ever found anything interesting on the ground or on the side of the road?
I found an old motorcycle glove once.
Yeah.
That's probably the most interesting thing I've ever found on the ground, actively thinking about it. I mean, I'm sure I found lots of things on the ground over the years, but none that, like, particularly takes my mind whilst out walking.
What is something you think everyone should do at least once in their lives?
I think travel overseas.
What is your favourite colour?
My favourite
Colour?
Dark blue. I don't know, I think that started when I was probably like 3 or 4. Had a bit of an obsession with Sonic the Hedgehog, so it's probably where I got that. And Dad always barracked for the Blue Boys. That said, I'd go for Richmond, but it's not really my choice and I don't really follow the football.
If money was no object, what is one thing you would buy?
If money was no object... Probably a way into outer space. Just to see the planet from, like, space.
Do you collect anything?
A few things. So I collect. I've got some stamps, but I don't actively. So I guess that's the real question: do I collect anything? So I have a stamp collection, but I don't actually collect stamps. I have some comic books that I collect, but it's very specific. I wouldn't call it a collection. I guess the only thing I really collect is video games and games. I guess would be the thing I collect, or have. Or, like, I guess something that I stockpile.
Okay.
Yeah, that's probably it.
Do you prefer coffee or tea?
Both.
Okay. If you could time travel, would you go to the past or the future?
I'd go to the past, simply because going to the future feels like a time paradox. Like, how does somebody from the past invent time travel and then go to the future when the people in the future still haven't actually figured out how to travel in time?
What is your favourite movie?
Favourite movie?
Mm-hmm.
Jesus.
If you have one.
But the first movie that always comes to mind is Blues Brothers, but
Oh, yeah.
I wouldn't say it's my favourite. It's just, I guess, a mixture of like classic nostalgia and appreciation for the music, I guess.
Mm-hmm. Right. So that was it. That's my first fun question. Alright, so now we're going to get to the serious bit. So, today's date. What is today's date?
The 2nd November...
2020.
2nd of November 2020.
Very good. Okay. What is your full name?
Hamish Llewellyn Kimpton McNally.
Date of birth?
2nd of September 1990.
And so your age at this time of the recording?
30.
So were you named after anyone?
So I'm not entirely sure how Mum and Dad came about Hamish. I think it was one of the names they had on the list of names they were going to pick for me. I think Mum said something about someone else having a similar, the same name or something around the time. I can't remember really. Llewellyn because it's Welsh, and Mum likes it. Kimpton is a bit more important. That was chosen because my grandpa, my grandpa and my uncle. Well, my grandpa had it as a. Geez, I can't remember. Yeah, I think so. Grandpa and my uncle both have it as a middle name, and so consequently it was chosen as one of my middle names as well. And McNally is obviously the family name.
Yeah. What state and city were you born?
So I was born in Melbourne,
Okay.
at St Vincent's.
Do you know what time you were born?
I don't know what time, and now that I think about it, I'm not sure if I was actually born at St Vincent's or that's where I ended up.
Okay.
But essentially I was a problem baby right from the start.
Okay, I was going to say, is there a story about your birth?
Yeah, so I was born, I think Mum said, I don't know, 33 weeks, I think. So I think that's early.
Yes.
So I was born prematurely with a deflated lung, and jaundice and I guess other complications that go along with all of that. I don't really know. Made it through just fine, I guess. So yeah, that's that. But yeah, I think, so born in Melbourne originally, spent the first 5 years there and then we shifted up here.
Okay.
5-6 years. It might have been 6, I can't remember. Dad and I were talking about it the other day and the dates are all... I mean, in my head I was in grade 1 in 1997, but apparently that's not the case.
Okay. And we don't want to talk about that. Do you want to talk about your parents? Do you know?
Yeah, I guess so. So I guess Mum and Dad, they're great.
Are they, what nationality are they?
Yeah, I don't know. Mum, I think, has some Italian heritage, if you go right back. Otherwise, best I know, are all just Australian.
They're born in Australia?
Yeah.
And do you have any brothers or sisters?
Yeah, so I've got one brother and one sister. Charlotte's... Why is this so hard? Charlotte's 23, Angus is 21. And yeah, that's them.
Do you have a closer relationship with one of them rather than the other?
No, I'd say I have equally close relationships with both of them.
No.
And just like the stuff we talk about and stuff just varies. But for the three of us, we have a lot of similarities and common interests anyway, so the three of us actually get along pretty well, despite the age gap.
It's a bit of an age gap, isn't it?
Hmm?
Do you have an extended family, aunts and uncles?
Yeah, we've got quite a few aunts and uncles, I guess. Not as many as some, but more than others, I guess. At the same time, though, like, we're not really close with a lot of them, so there's probably only a few that we're fairly close with. That'd be Uncle Matt and Sally, who sort of sometimes live here with us up on there. They've got like a house they're building up up our driveway.
Do they have children? Like, have you got cousins?
No, they don't have kids. We've got cousins there, but they're sort of spread quite far and wide. So we've got family over in Canada with cousins that are about the same age as us, and then we've got family over in New Zealand. The cousins over there are sort of all around 10, so quite a bit younger than us. And then we've got, I guess, more extended family in like WA and down in Melbourne, obviously. Some of which cousins similar ages to Charlotte and Angus, but I haven't seen them since they were like 2 or 3, just because of family quarrels and stuff, I guess. It usually happens, but I think it's more just sort of, when you sort of fall out of contact, it just sort of becomes harder to get back in contact.
Alright, so thinking about your childhood, so where did you go to school? Primary school?
So I started primary school at Richmond Primary School when I was 5, I think. And I only stayed there and did 1 year, which was prep, obviously, before we shifted up here. I specifically remember the teacher being not the worst teacher in the world, but Mum and Dad will tell you otherwise. They say she was nasty and I guess a bitch from hell, but all I really remember is basically being told to be quiet all the time, which landed me behind a big sort of red cardboard box almost every day. So I'd spend probably half an hour or more sitting behind this box every day because I talked in class. So I always attribute the fact that I was kept down and, whatnot, not so much to the fact that I talked in class as to how the teacher handled it. Like, it's one thing for a prep to talk in class, it's another thing to make him go and sit down behind the box for half an hour every day. And I guess over a period of a year, well, you lose substantial amount of education, I guess, I don't know. And her plan was basically, I think that was the thing that set Mum and Dad off, was at about the 6-month period, she was like, we'll just let him do whatever he wants, and then next year we'll rein him in. And that was when Mum and Dad were like, yeah, no thanks, I think we'll just go to another school. So we shifted up to Buninyong, and I spent my second year in prep under the guidance of Mr. Mould at Buninyong Primary School, and that was great. And then, grade 1, grade 2, grade 3, grade 4, grade 5, and grade 6 were all spent at Buninyong Primary School as well. Grade 6 I managed to get Mr. Mould again, so I had the same teacher for prep and grade 6, which was great because he was a great teacher. And I think that's when the cancer hit the first time. It was end of October the 13th or 14th, 2003. So the end of grade 6.
No. Do you want to talk about that?
Yeah, that's a long story. That's going to pop up a bit because that's kind of my life really. I mean, everybody knows it, but yeah, it sort of started then, grade 6, end of grade 6.
Who noticed?
Hmm?
Who noticed first? Like, how did you?
So that weekend I was, I can't even remember the days, but basically I was hanging out with the Scouts at the time, I think, and we'd done like a sort of, I don't know, raise money for camps and stuff event thing at the Mount Clear Church. At the church in Mount Clear, I can't remember. I'm not a huge religious person, but for whatever reason we were doing something at the church.
Yeah.
And basically that day I think I remember feeling like a little bit sort of like tired, lethargic, I guess, would be the clinical term these days, but as a kid you don't really pick up on it. It wasn't until the next day, the following day. So I spent that night at my best mate's at the time, Sean's place. Mm-hmm. And I remember sort of waking up in the morning and just telling his mum, Terry, lovely person, I remember telling her that, like, because she was a nurse and stuff, so I knew I was in good hands. I remember sort of waking up and telling her, I was like, oh, your back's really, like, sore and it's, like, aching and it just won't stop. Like, it's quite unpleasant. And she rang Mum. Mum came round, picked me up, took me home, and I spent basically that entire day laying on the couch. I think it was a Sunday or a Saturday. It had to be the weekend because at the end of the day, after I'd sort of spent the day lying on the couch feeling like shit with a headache and my eyes were starting to hurt from the light, Mum basically convinced Dad to well, she didn't really convince Dad. She basically told Dad I'm taking him down to emergency to get some tests and stuff done. So we went down to emergency. They took some tests, blood tests, and I think they did it like 3 or 4 times. And I basically remember by the 4th time, being 13, I was like, I'm sick of this. I don't want any more bloody needles. Sad story for me is I didn't know what I was about to get into, so needles were just the beginning. Yeah, so I said no to any more needles, and then they took me up and let me sleep overnight and stuff. Started pumping me full of antibiotics and fluids, just in case it was bacterial or viral or any other thing, precautionary hospital stuff. And the next day I just remember sort of sitting in the bed, still feeling okay but not brilliant, playing Halo on the Xbox that the hospital had provided, and Dad and the doctor walking down the hallway with my little brother in Dad's hand, and just the 3 of them sort of coming into the room, and then the doctor and Dad sort of taking up opposite positions either side of the bed and sort of sitting down, Dad with Angus, and then the doctor just sort of saying, you know, look, I've got some news we need to tell you, Hamish, and that's sort of how they broke it to me as a 13-year-old. My understanding is Mum has since later gone back and looked at the file and stuff, because the hospital sort of didn't tell us anything overnight or anything like that, which Mum's always sort of been a bit shitty about. I don't know why. I think something to do with they knew sooner than what they told us. Like, they basically already confirmed that I had acute myeloid leukemia, but didn't sort of want to take the responsibility of saying that that was the case, I guess. I don't know. Not when I think part of it comes down to the bureaucratics and the ability to move patients between hospitals. So I think they were sort of looking to get me down to the children's ASAP, and the fastest way to do that was basically by not acknowledging that I had anything, because that would mean that they'd have to admit me and then they'd have to fill out more paperwork to get me on the road, and they needed me down there ASAP to start treatment. So I don't know how it works, but there's a lot of things involved. And essentially I said, cool, they took me down to RMCH. I'm going to get confused there because I've been to both, so it's like RMCH and RMH. And so I went down to the Children's Hospital at 13, And they basically took me and did what's called a bone marrow biopsy, or aspirate, I think sometimes they call it, which is a really simple procedure actually. They just stick a giant needle in your hip and take a small sample of bone marrow once, and that's it. It's pretty painless. It might be a bit sore for a day afterwards, but that's about it. And then essentially they take account of the blasts, which is like an underdeveloped stage of blood cell before it becomes like red, white, or plasma, or any of the other substances that make up your blood. And so if the blast count is too high, that's basically the indicator that you have acute myeloid leukemia, which is essentially basically just saying that Mum always sort of referred to it as like a blood disorder rather than a cancer, because it doesn't grow or develop. It's just your body's producing, your body's basically just producing eggs that never turn into chickens in vast quantities. I guess that's the best way to describe it. It's obviously more complicated than that, but it's a simplified version.
Yes.
So past that, they wanted to start treatment almost immediately, like basically the same day. I argued against that and said, no, let me go back to Ballarat for 24 hours. I want to, if there's a chance I'm going to die, I want to say goodbye to everyone beforehand. So I came back up here and basically just let the primary school kids and everyone there know what was going on. And where I was going to be, so I then spent the next, and it's sort of hard, like, I remember bits and pieces from the treatment over the course of 6 to 12 months, but essentially for me it was like primary school, high school, and it was just a blur in between.
How long were you at that children's hospital the first time having the treatment? When you went back after coming back?
Yeah, so treatment for AML involves usually about 6 months of intensive chemo and other drugs, obviously, just to sort of keep you alive and counteract the chemo and stuff. After which, back then, I don't know what the protocol is now because it changes all the time. Back then it was, if you went into remission after round 1 or round 2, they do another biopsy after every round of chemo just to check on the progress of the cancer, and check the blast count and stuff. And so they did that, and if you go into remission after the first round or 2, they'll skip out on the bone marrow transplant if you like, or if you opt to. I mean, you can always obviously opt to skip out of it at any time, but realistically they sort of say that if you don't go into remission after round 1 or 2, they really want to give you the bone marrow transplant just to sort of clear it up. So I didn't go into remission, I think, till after like round 4 or 5 the first time round, which isn't bad. Like, it sounds bad because you need the bone marrow transplant, but...
Did you have that? Did you have that?
I did have that. So in hindsight, realistically, I don't think beating AML without a bone marrow transplant is really plausible. Like, there are people that have done it, but it'd have to be like a really mild case. Sort of like, I guess, living with a tumour on your arm, like, it's so easy to cut out, you just do it anyway. But I don't know, I can't really speak from a gross tumour perspective because I've never actually had any tumours. So. So after that...
So how old are you now?
So 30 now. So so 13. So I'm still 13.
13, okay. Yeah.
And I'm on my way to 14 in 2007. So yeah, I got the bone marrow transplant in 2004. I think it was March. It's like the same day as Dad's birthday, I think, or very close to, or something like that. And the bone marrow itself came from Mum, which is really rare, or at least it was at the time, because of human genetics, basically. So in order to get a match from a parent, so it's a 1 in 4 chance that you have matching one of your siblings, and it's like exponential from there, but I can't remember the number for parents precisely, but it's something to do with the 6 chromosomes that you have in your blood that make up like markers to decide whether matches and stuff work. Like, it's similar to the A negative, B, all that stuff with the blood, but it's a bit more in depth than that. And so in order to get a 6 out of 6 match from your parents, your mum and dad have to have a certain number of same chromosomes, and then on top of that, the ones that you get from your dad, you have to be the ones that are different that your mum doesn't have, and you have to get all the ones that they share in common from your mum, if that makes sense. So it's like really random. I don't know.
Yes.
Out of so they'd done something like 300 transplants when I got my first one. And in that time they'd only had 4 parents match or something like that. So yeah, it was like not likely.
But she was. What your mum was?
Yep. Oh. And she was a 6 out of 6, which is like the best you can get, I guess, which is probably why it grafted so well the first time round. So when you get a bone marrow transplant, it's a bit different to getting like an organ transplant of any other kind. So when you get a transplant, you always go on immunosuppressant drugs to suppress the immune system so that it doesn't reject the new transplanted organ, I guess.
Yes.
With bone marrow, it's a little bit more complicated / different. Because your immune system is sort of tied into your bone marrow and blood and the lymph glands and stuff in your up here and stuff and whatnot. Essentially what happens is when you get the bone marrow from someone else, you're also sort of acquiring part of their immune system, and so consequently their immune system, or now your immune system I guess, starts to attack the entire body and sees it as the foreign object and the threat instead of the one organ.
Yeah.
In mild amounts, it's beneficial because whilst the new immune system is attacking the entire body, it's also attacking the leukemia cells from before as well. So it's sort of you get sort of what's called the graft versus leukemia effect, and they call that separate because the whole thing is called graft versus host disease, or GVHD for short. But when because it's attacking the whole body and the leukemia cancer cells were a part of your body, it still sort of sees them as a foreign object and attacks them too. So if the chemo and radiation doesn't finish the job, then yeah, the bone marrow transplant and the immune system that you acquire afterwards often does sort of fix off the last little bits. That said, relapses still occur, and even though I got some GVHD afterwards and it wasn't severe, and I basically went back to a normal life throughout high school.
Where did you go to high school?
Mount Clear. Yeah, so I went to Mount Clear. That was by choice. Dad wanted to send me to Ballarat and Clarendon, and I insisted on going to Mount Clear, and then after I got cancer, well, he didn't have a say in the matter anymore. So if any grade 6s are listening and they want to go to a different high school with all their friends, and their dad's saying no, just get cancer and you'll be fine.
So you're in remission while you're in high school?
Yep.
Is that right?
Yep. So I went into remission towards the end of grade 6, but of course that's only the start of it, because once you're in remission and you've had the transplant, you've got to spend a month in isolation, and when I say isolation, I don't mean like the mask-wearing COVID isolation. I mean they put you in a tiny room, and the only people allowed in are doctors and anyone who needs to actually see you. The nurses will come in 2 or 3 times a day, but only when you buzz, and they'd rather not. And you can have your parents plus one other.
For how long did you say?
1 month for me. I was on the upper end of the scale average, 42 days. The average is closer to sort of 33 at the time. I was trying to get out early, but it didn't happen. I got out late. That said, I've heard stories of people spending much longer, anywhere up to, I was surprised when I first heard, but yeah, anywhere up to 6 months. So when you're in isolation, the reason for that after the transplant is because after they give you the radiation therapy is designed to kill off all the bone marrow in your bones so that they can put the new bone marrow in. When they put the new bone marrow in, it takes time for it to settle in and graft. Once that's happened, they need to then wait for what's called neutrophils to come back up, which is a key factor of, I don't exactly know how they work, but the number is 11, and basically if the number's not 11, you're at a very severe risk of infection. So even now, for example, even though I'm immunocompromised still today as we speak, and my immune system's probably shot left, right and centre from all the treatment and stuff over the years, at the same time, like, because I still have the neutrophil count that's probably up there somewhere near that number, and of course I take antibiotics and stuff on a daily basis, so as a result of that, it's still like I'm not even close to that level of susceptibility. I think when people think immunocompromised, they just think everybody's like suddenly at risk of everything, you know. And it's a lot more complicated than that. There's different aspects to the immune system that make it up, that sort of fight off different things in different ways and react in different ways. So like, you know, you might be really good at fighting off bacterial infections on the skin, for example, because of what you eat and your diet and, you know, genetics and all the rest of it. But then you might be really susceptible to viruses. So it's a bit sort of 50-50, I guess. I don't know. But anyway, so I spent a month in the isolation room in the hospital at the Children's. And I'll be honest, it's shit, but the time kind of fades away because the first week is really long as you're sort of adjusting, and then the last week is really long also as you're sort of watching the numbers climb back up and you just want to get out.
What are you doing day by day? Reading?
That's the thing, I think people always ask me this, you know, like, it's been my entire life, they're like, what do you do with your days?
Yeah.
And I'm like, sit around, play games, just whatever, chill, relax, like, think, you know, like, I think people get hung up on working every day and then they don't know how to sort of just sit still. At the same time though, like, I don't think sitting still is healthy either. Like, I really think, you know, you do need something to occupy yourself on a day-to-day basis, even if it is just something small. But I don't think being alone or isolated is necessarily bad either. Like, it gives you a chance to reflect on your own thoughts and self, I guess, and think about the direction you want to go in rather than where society or anyone else is pushing you. That was off topic.
That's okay. You got through that month, and then they let you out.
You
came back here.
Yep. So they let me out, and part of that is after the transplant they let you out, and you'll spend probably the next 6 months sort of in and out of hospital with various infections anyway. And you'll fight them off and beat them, and then they'll send you home, and you'll be home for like maybe 4 or 5 days, and then you'll get another temperature, and you'll have to go back in because as soon as you get a temperature, they want to put you on antibiotics and treat you for whatever, just in case. And then once you make it through all of that and get out the other side, then things start to sort of normalise a bit. You always go back for checkups, but the time between them sort of starts to get further and further apart, which is great. And, you know, I think when I was finished with that first transplant, all my hair came back. I was on a large amount of steroids initially, so I'm like puffy and chubby around the face now, and it was quite a bit worse back then, and there's photos floating around online if anyone ever wants to look. And yeah, so steroids sort of make you swell up like a chipmunk, twofold, because they prevent you from, they sort of make you retain body fluid quite a bit, But on top of that, they remove the steroids I was on. Make you sort of really not hungry, but they sort of remove the feeling of full. So you just keep eating and eating and eating without realizing that you're actually overeating. And then when you get bored, you start to eat more anyway, because it's like a never-ending cycle. So most people put on quite a bit of weight when they're on high doses of prednisone. You can control it if you're really good at self-control, I guess. I unfortunately lack self-control in vast amounts, at least in that regard. So I think because that's the scary thing too, like, you go into your cancer treatment for AML, and like they pump you full of chemo and radiation, and that removes your appetite, and you stop eating, and everything goes to shit down here, amongst other things. And so you lose weight, and you end up, as I was, I was like 13, 14, and I think I weighed like 50 kilos maybe down to 60, I think, at my lowest there. And then within the space of probably 12 months, I went from 60 kilos to about 110.
Because of the steroids.
Yep. I shot up like a balloon. I mean, that was probably also because 13, 14 still growing, so there was a bit of height too, but mostly I'd say it was fat. Fat, muscle and bone all just sort of piled on. Anyway, and then getting it off, I probably spent 2 years putting it on, maybe a bit less. Probably about a year, I'd say a year and a half putting it on, and then I probably spent a year just living with it, and it sort of came down gradually a bit and settled at about 90. And then, I'd say that's probably where it was when I was in year 12. I was probably about 91, 92, as far as my weight was concerned, but I looked like an ordinary individual.
So you're only on the steroids for a certain amount of time?
Yeah, so after I actually got out, I was off all of the drugs that I was on, tablet-wise, I guess, because there's a lot of drugs they just give you like once off for, to do something or to get rid of something or whatever. Yes. But anything you take on a regular basis was like tablets and stuff. I was off everything 6 months out, I think, 6 or 8 months out. The only thing I had to consistently take after that was 5 milligrams of Ramipril, and that was just to manage my blood pressure, which could have been caused by the cyclosporin or chemo and stuff, but far more likely was just because we have a family history of it, so it was probably undiagnosed before I actually got cancer. So as a 14-year-old, I was always on my blood pressure medication. Their theory was back then that would essentially extend my life by about 30 years, even though I wasn't feeling any symptoms or anything like that. Like, it was just sort of, my blood pressure always sort of sat, I guess, a little bit high, and they said that, over the course of your life, if we leave it untreated, it'll be a problem. Which is a bit like diabetes, really, which I still don't manage properly.
Alright, we're at the end of year 12.
So, end of year 12, and the cancer comes back again. It's quite polite, this one. It likes to just sort of screw me around at the end of things. So where are we? 2009. 2009, end of year 12. Cancer comes back again, and this time I'm sort of ready for it, I guess.
Was it found because of your checkups? Or did you
so it was found during one of the routine checkups. They checked my blood work, and so if you remember when I said earlier that the blast cells build up and up and up, and they're like sort of undeveloped blood cells, I guess. There's more indicators than that. So the other thing that can be an indicator is the body sort of mass produces white blood cells or plasma as sort of like an immunoresponse, and that's normal when the body has like an infection or something's wrong, like it always does that. but usually it sort of goes down within like a week or so. So they tested that and they saw that it was up and they're like, yeah, it's probably nothing, but come back in 2 weeks and we'll check again. So we went back 2 weeks later and they took another blood sample and they were still high, and he said, right, it's probably not viral at this point. And so they did another bone marrow aspirate, and the blast count was, I think I remember at the time they said, it was up and abnormally up. Like it wasn't critical or dangerous like it was the first time around, but it was up enough that it wasn't considered to be a normal amount. And so they said, look, you've definitely got it again. And I think then they did another aspirate a few days later just to confirm, before starting the chemo and radiation, or not the radiation this time. They just did, I think it was 3 really intense rounds of chemotherapy, followed by another bone marrow transplant, but without the radiation. So the chemo they used this time was sort of designed to replace the radiation therapy from the first time, because they decided that I'd already had too much exposure. It's not too much, they just didn't want to risk that this time round for that, when they knew they were probably going to need to save it for later, for x-rays and CT scans and things down the track. So that...
how long was that treatment?
I'm just trying to think. That took about 6 months, I think. And so that was 2009, and I spent my 19th birthday, or was it my 20th? No, it's my 19th. My 19th birthday I spent in hospital. And that was because it was like end of July, mid-August, I think, when we found out that it was back, and it was just before my brother's birthday. And I was admitted before my brother's birthday, or just after, I think. Because he's born on the 23rd, so his birthday is 9 days before mine. I mean, it wasn't too bad. Like I said, I was expecting it this time, so I went back to high school, because, they weren't new doctors, so I should probably mention that. When it came back, the original re-diagnosis/testing was done at RMCH, because I was still going down there even as a 18-year-old, because they sort of hold on to you until you're 18, especially if you've got like a history there as a child. They'll only sort of move you along if they feel it's necessary at some point, which in this case they did. So at 18 they said, righto, we treated you the first time round, but you're technically an adult now, so we need to pass you into the adult system. And so that's what they did. My doctor at the time teed me up with a doctor at RMH, Dr. Roberts, Andrew Roberts. I think he's actually a professor. I always call him Dr. Roberts, but it's just, I don't know how I've always called him, but he's a professor. Professor Andrew Roberts and the team at RMH, and he's basically been treating me since then. So I was 18 when I met Andrew, and I'm now 30, so for the last 12 years I've had the same oncologist. And I've lost my train of thought again.
That course, the second course, you got through it?
Yeah, we got through the second course of chemo, and they gave me another transplant.
Was that from Mum as well?
No, hang on. Yeah, we've skipped details here.
Oh, okay.
So before they gave me that next lot of chemo and the second transplant, what they tried to do was induce the graft versus host disease. I should probably pause there, because the graft versus host disease is actually what's killing me now, but for a different reason. It's the reason I look the way I do, even 10 years later after. Even though the cancer's gone, in remission, and I was healthy and stuff, the GVHD is actually what's caused a lot of the ongoing health problems that we'll get into later, because they're a lot more severe than the cancer. Everybody always thinks cancer's the worst thing out there. It's not even close. Anyway, so so they tried to induce some GVHD, by giving me more of Mum's T cells, which is a bit different to a transplant because she has to take, she has to put really painful injections in her gut. I don't know, hormone or something, I can't remember, but they do it for a lot of things, and apparently it's painful. And it essentially makes the bone marrow overproduce and sort of swell up and produce more, I guess, more T cells and things into the blood. And then they harvest the T cells directly out of her blood by basically centrifuge and connecting wires and stuff.
Yes.
And so they did that, and that essentially failed. They put Mum's bone marrow in me, blank slate without removing mine or anything like that, and nothing happened, unfortunately, which is not what we wanted.
No.
That would have been the easy way out. A little bit of GVHD would have been a lot better than chemotherapy and the rest of it. Anyway, yeah, so there you go. That always interests me, that they use like rejection to actually fight some things. Like nothing is ever really truly completely bad in this world. There's always a use for everything. Anyway, after that didn't work, they gave me, I think it was 3 or 4 rounds. It was called the FLA regime. They have so chemotherapy, when you say it, is really just a broad term for poisonous substance that goes into the human body. That substance can be any one of a number of things off a very long list, from cyanide to silver nitrate to radioactive particles instilled inside saline. I don't know. The list goes on. So the FLA regime, I got no idea what drugs are in it, other than that I know the A stands for amphotericin, and that stuff is shit. Or maybe it doesn't. Maybe that might be the anti-fung. I don't know. I'm so off track. Anyway, they gave me more chemo, and then they put a unrelated matched donor, or MUD as they call it, a MUD donor, a MUD transplant, matched unrelated donor, I don't know what it stands for, and they put that in me, and that was I think it was a 5 out of 6 match from, and the only thing I know about it is that it was another woman, so I don't know her name, who she was, or anything like that. I think we did try to reach out once, but sort of one of those hit and miss things. And that one has essentially worked since. If worked is what you want to call it. The 5 out of 6 match.
Were you 19? You were 19?
Yeah. And so I was 19 at the time when I got that one. And I think that one I don't think I got that transplant either towards the end of 2009 or somewhere near the start of 2010. It's always right in that area of the year. And yeah, I guess that's when the problem started.
I thought you're fixed now. No?
Yeah, that's the way a lot of people see it.
That's what we think. Okay.
And the worst part is, like, people see me and then you tell them, and then they're like, "Oh, so you're good now?" And I'm like, "Yeah, the cancer's gone, but I'm not good."
Can you tell me about that?
Yeah. So, over the last 8 years of my life, so yeah, 19 to 22, the GVH was around, but it wasn't terrible. So I was seeing a girl from school called Kat. She was lovely. And, I mean, we broke up after 2 years for reasons, but it doesn't matter. Anyway, by the time I was 21, the GVHD had really sort of started to, I guess, set in. My hair was starting to thin, like it had sort of, after the chemo and stuff, it started to grow back again and come back, and when it does, it comes back really soft and curly and like baby hair, and then you sort of have to wait for it to grow out over 3 months and shave it, and then you get your normal hair back again. Because the first time it grows, it's like touching baby's hair. It's like super fine and soft. It's really stupid. Anyway, so that grows back and you have to cut it off and get your real hair back again. and that started, like, it started to grow back, and then the GVHD sort of started to kick in, and I didn't realise how bad it was, because I always just sort of looked at my skin and was like, oh yeah, a little bit of a rash there and there, like, that's the first thing that usually shows up. But I never really sort of expected all the other severe consequences that were going to come along with it. And I guess Mum and the doctor sort of saw it starting, but I didn't get my first sort of realisation that it was actually sort of a big issue until I was out at Warburton with a mate, and we were working on my car at the time, and we were stripping wires, and I put one in my mouth and pulled it out. And it wasn't hard, like, I didn't, like, give it a big tug or anything like that. It was just, like, bite, chew, like, it had already been worn down. It just needed to be pulled off, basically.
Yes.
And, yeah, in the act of pulling the cable off, I chipped one of my front teeth, like, half the tooth just broke off. And I remember sitting there in the car with my tooth in my hand and my friend just laughing. And I'm like, well, that's shit. And then... So we went to the dentist, got that fixed, obviously, but to no avail, because within about 6 months, in that same 6 month period after we got that one first fixed, every time I did anything, it didn't matter if I was eating chocolate cake, or if I bit into an apple a little bit too hard, or lasagna, bits of my teeth were falling out, left, right and centre, like just massive chunks. Like, it was like suddenly all my teeth had just been made out of cheap rock, and you hit them with a hammer and they break apart. So by the end of sort of 6 to 8 months, all I really had left was 2 rows of jagged mess, I guess. Highly sensitive jagged mess. There were quite a few loose nerves in there at the time, which eventually led to the dental team down at RMH basically deciding, yeah, look, you know, you've got no saliva in your mouth, and that's why your teeth are decaying so rapidly. Essentially, the GVHD had sort of killed off all the saliva glands in my mouth, and even to this day, I don't produce saliva. And it's quite hard for some people to grasp, like, oh yes, you know, you don't produce any saliva, but you know, your mouth's still like a little bit, like, you know, moist or whatever. It's like, no, it's bone dry. You can stick your hand in there and pull it out and it'll be dry. So, yeah, without saliva, teeth deteriorate quite fast. Almost overnight, I would say. And so I had them all extracted, and I think that was about 22, and they put some titanium rods top and bottom, and now I have a fantastic set of fake chompers that sort of look semi-permanent. They function okay, but they're not great. Like, the top ones move around a bit and fall out occasionally, and it's a bit annoying, and they get loose and you've got to maintain them. And the bright side is you don't have to brush quite as often, and if you swish a glass of Coke around in your mouth, it's brilliant at cleaning things. But realistically, not really a positive. I mean, they're just the pros to the massive list of cons from not having your own teeth.
How did they fix the saliva issue?
They don't. They have options. There's lots of fake salivas out there. Honestly, though, like, when it comes to eating food and stuff, the last thing you want to do is put in, like, minty fresh fake saliva while you're eating a hamburger. And then they're like, oh, it's flavourless. Yeah, it's never really quite flavourless. And then they're like, but this one's extra, and it's like made out of gel or whatever, and it's like extra lubricating, and it just feels weird. The best solution is just let your mouth go dry and have some water every now and again. Milk's really good. Milk's a better lubricant, but the problem is it sort of builds up phlegm because you've got nothing to...
Oh, right.
So you end up coughing the milk phlegm back up, and that's disgusting. But I do like my milk drinks. It's just not practical in a social environment. And I guess, yeah, it's the same with, like, food and stuff. You know, when you eat, I always, like, there isn't a time I eat something without a drink unless it's, like, soup.
Oh, right.
And it does have to be really moist. Like, even something like lasagna, I still need a glass of water to consume. Same with, like, pasta dishes and stuff. Like, you think it's wet and moist, and it is, but it's not wet and moist enough to go down your throat.
Right. So crackers are off the table. Crackers are off the table.
Yeah, I mean, yeah, but, like, I'll still go to a party and pick up the crackers and the cheese and the dip, and then I'll just get a glass of water, and I'll be sitting there kind of one cracker, bit of cheese, water, one cracker, cheese. I guess it's a good weight loss regime, because, you know, every time you eat you've got a drink, and it fills you up a bit more, so... but that sort of leads to its own problems as well, so the GVHD took away the saliva, and then as sort of a result of that, it also took away my tears. Which, speaking of, I need to go grab some, because my eyes are actually getting a little bit dry.
I'll pause.
Saliva. The difference is the fake tears actually work. And I've become quite proficient at it.
And that's very important, isn't it, for your eyeballs to
have
moisture?
So lubrication is quite key for eyesight.
Yes.
And so consequently my eyesight did take a bit of a dip back in 22 and then came back up a bit. It's still not great, but it's not as bad as it could be. So the other thing revolving around the eyes is I've had cataracts in both eyes and had them removed out of the left eye as they're still in the right eye. Simply because they need them to sort of grow a bit more. Not so much these days, but the doctor sort of pointed out that if we operate on the right eye, you'll lose any ability to, like, focus, and then you have to start wearing glasses, which doesn't bother me, but it's just that, like, sort of at the moment this eye is not bad enough to sort of justify it. Yeah, so the tears work really well. The fake tears, I use Celluvisc. There's lots of other options, gel options and things. To the best of my knowledge, there's no treatments that will ever restore saliva, tears, stuff like that. My understanding is that the glands and things that produce sweat, because that's the other thing I don't do, I don't sweat a lot except around my ankles occasionally during summer. Any of those, like, glands that produce those things, because they're so small, they tend to be the first thing hit by the GVHD when it spreads out. And so the other thing that took a hit was my hearing, but that was, I guess, kind of more my own fault the first time round. I went swimming despite them telling me not to, numerous occasions. They were always sort of worried about the central line getting infected. They never really sort of pointed out that, you know, you're also at risk of getting all sorts of other infections in other areas besides here, and, like, we sort of knew that, but it wasn't really sort of, back then it wasn't quite as sort of explained, whereas, like, the second time round when I went to RMH, they're like, don't go swimming, it's not just the sight that might get infected, you know, you might get something in your eyes or your ears or anywhere else that might cause something, so please stay out of large bodies of water. And that was great, but I mean, I got so many less infections the second time around too, I think just because, A, being an adult, your immune system's a lot more, I guess, robust. Yeah. And so consequently, after they discharged me from my second transplant, I was probably only back in hospital with infections. Maybe 2 or 3 times, I think. Definitely nowhere near the number I was the first time. And yeah, so it was a much quicker process, the whole, like, I guess, recovery, healing. But still, onwards, 22 to 30. So the big time gap now is 22 to 30, and I'd say that's probably where the vast majority of my life has happened. After cancer. It's weird, like, cancer's a big part of my life, and it has been, but now I sort of feel like it's small and insignificant by comparison to everything else since. so obviously I had cancer twice,
Yes.
and then we sort of finished with that by 2011. 2012 was a great year. I can't remember. I can't remember specifics. I never can. All I know is 2012, 2013. Great years. I think I spent a lot of time sort of just buying stuff and living out of the bungalow and sitting around at home and stuff. And then it was probably after 2014, I guess. I started drinking when I was 22. I say started drinking. What I mean is I'd never really sort of touched alcohol to any sort of level to make me even remotely tipsy until the age of 22. And I think a friend and I together finished off a bottle of vodka one night. And that was probably my first experience with like an amount of alcohol that does anything besides make you feel good.
Yeah.
And after that, it sort of became almost like a weekend thing. Just go out, party, get hammered. And that went on for 3 or 4 years, during which I had 2 employment jobs that were basically paid for by the government, for 6 months here and 6 months there. And I think essentially what happened there is the businesses decided to let me go after the government stopped paying the wages at the end of 6 months because, well, I'm over 21, I cost too much. And what's more, I wasn't capable of doing all the same amount of work as a 16-year-old, so why keep me?
Yes.
On top of that, partying and making new friends every other weekend, which was probably the key stages of my life. And somewhere along the way, my dad's youngest brother passed away from a heart attack, which was a bit sad, shocking. And one of his other brothers had a heart attack probably about 6 months before that, but survived. And so what was really scary about that was in 2014, I woke up one night, unable to breathe, essentially. I woke up just kind of, it's really hard to explain. I was breathing, like taking big, long, deep breaths, but it just didn't feel like any of the oxygen was like making its way into my lungs, which is not the case. It was getting into my lungs. The problem was actually my heart. So we got down to, because that night conveniently I was staying in Melbourne with Mum at Grandma's in Glen Iris. So I woke Mum up at like 1 or 2 o'clock in the morning or something, basically struggling to breathe, and we drove down to RMH ourselves and admitted myself to emergency right there on the spot. And that night they called the rest of the family down. Dad, Angus, my sister, all came down the highway. And I think by about 7 o'clock that morning, 7 a.m., I don't remember much because as soon as I'd gotten there, they'd basically taken me straight through and dosed me up on painkillers and stuff, which I've always thought was amazing. I love painkillers. Not so much when I get out. They're really shit when you get out of hospital, but they're really good when you're in pain or discomfort. They really are amazing. And so all I remember was the oncology team from upstairs, who I hadn't met because I'd only really sort of at this point in my life for the last 4 or 5 years been interacting with my oncologist professor. And so when you're getting treatment and stuff, they usually all come, like every morning you'll have like 10 people at the foot of your bed. That's just how it is in cancer. But of course I didn't get to see the other 10 people anymore because now I was just seeing my doctor every 6 months. So here I am meeting the new team, and they're all like, okay, we're going to intubate you. And I'm like, cool, whatever, I don't care. Do what you got to do, just make the pain go away. Which has always sort of been the way I am. When it comes to an operation or something, I'm like, just go, I don't care, you don't need to explain it to me, I don't want to know.
What kind of pain?
It's just, so, it's hard to think back, but I don't think, pain isn't always pain. Sometimes it's just incredible discomfort. And in this case, that's basically what it was. It was like
something to do with your heart causing it.
Yeah, so the heart caused it, but when you're breathing and the heart, so what had happened was I had what was called congestive heart failure, and essentially the heart had was being attacked, but that they couldn't analyse the exact problem, but they suspect it was a combination of chemotherapy, drugs, and viral stuff and things. And essentially they think that over the years that it sort of damaged the heart muscles. And so the heart sort of starts, so when you have congestive heart failure, or the type of heart failure I had, the heart sort of pumps not quite as strong and starts to get like a weaker pump. But then to compensate for that, the heart starts trying to beat faster as well. So it gets weaker and tries to speed up to compensate for the lack of strength and to pump more blood around. But in doing so it gets the heart rate like right up to like 160 beats per minute or something. And even though you're sitting still and taking nice long deep breaths, trying to breathe really calmly, your heart's beating 1,000,000 miles an hour, and apparently that's bad. So the doctors, have to sort of, now they've got to sort of like slow the heart down and fix it whilst also trying to get you to get enough oxygen, I guess is the problem. And so I spent a week...
So they wanted to knock you out?
Yeah, they knocked me out. They intubated me. So I didn't even know what it meant at the time. They just said intubate, and I just thought that meant stick a tube down my throat. I didn't realise that it meant I was going to be unconscious for a week.
Oh, a week.
So I basically just signed the forms and went off to sleep and woke up a week later with no clue.
Now you know what happened that week.
Yeah, and I didn't realise how serious it was at the time. I mean, I knew it was serious, but I didn't realise how serious. And yeah, they sort of, I guess I remember being in a stupor occasionally, coming to, like, I have these fleeting memories in ICU of me being, like, completely unintelligible. I specifically remember on a couple of occasions where Mum had, like, given me my phone back despite that not being the wisest option, and me trying to operate the phone and getting really frustrated with myself because, like, either I couldn't click the right button or I'd click the right button at the wrong one and go back and it wasn't working. And so they brought in, like, a Ouija board, point to the letters, tell us what you want. And so I think probably the sanest moment I had while I was unconscious was they brought me around about halfway through, apparently, and there's a great photo of it because Mum took a photo, and it's basically like me lying in the ICU bed connected to, like, I don't know, probably more wires than I've ever been connected to in the past, but still not the most. A tube down my throat, I had a catheter down there, wires monitoring the heart, and I think some more over here, plus the intravenous lines in both arms for various other things. And so, despite all that, they sort of, like, brung me back around, and you can see in my eyes, they're still, like, up in my fucking head. And I think Mum said something like, "How you going, Ham?" And all you get was this, like, photo of me going like this, with my eyes in my head with everything attached. So I think that was the inspiring moment for the family, which they clearly needed afterwards. I didn't realise they needed it till afterwards, but the oncologist that had been seeing me for 6 years, he came down on the second or third day or something and, told them they need to say their goodbyes. Yeah, I think they basically told them, you need to say your goodbyes, and so that was that. And then they woke me up a week later, and I was, as far as I was concerned, I was fine. I do remember they sort of had me coming around, they sort of, like, wean you off the drugs over the course of an hour or whatever, and you slowly come to, and everybody sort of, like, not everybody, but the nurse sort of hangs around and keeps an eye on you. And the reason for that is so that when you come out, you don't try to speak.
They don't like it.
Unfortunately, they all had their backs to me when I came around, and I was like, and they come over and they're like, "Don't talk." And she's like, "Shh, you need to be quiet." And then so you sit there and quiet, and then they explain to you how they're going to get the tube out, which is nerve-wracking because it's not pleasant.
But you have to be awake while they're doing that.
Yeah, you do. Well, you don't have to be awake while they do it, but maybe, I don't know. It must. Yeah, no, I think you do, preferably, because there's stuff you can do that actually makes it easier for them and less risky, I guess.
Yeah.
I mean, that said, like, I've had So they put Hickman lines in your chest here, and you get scars, and that runs up along under the skin and then into the carotid artery down here, which is what they use for cancer treatment, that or a port or other things. But generally speaking, with AML, you get like a Hickman line. It's like a permanent central line, essentially. And it runs into the heart almost directly. Not quite, but it goes right to the top of the valves, if that makes sense. And so to get that out, when they do it, they're designed to just basically be pulled out, and then a nurse has to apply pressure for 10-15 minutes to the side of the neck while the clot forms, and then you're not allowed to do anything for the next day. But that's not pleasant either. And to be honest, I think having this pulled out, less painful but more scary and unpleasant. More painful but not as scary and unpleasant. If that makes sense. Like, it hurts a lot, but like, you're just sort of like, oh god, if he lets go, I'm a dead person. But like, he's there, and you're in a hospital, so you don't feel that risk. Whereas like, having a tube pulled out of your lungs, like, that's right down inside there, like, and it's not actually, it only goes to like here or something, or sternum or something, it doesn't even go into the lungs. So,
and then you found out what they did with you in that week?
Yeah, so after I came to, the first thing I tried to do, obviously, was get out of bed and go to the toilet, to which they then told me, you've got a catheter in, and I said, oh, okay, well, it's not working because I feel like I need to pee right now. And she jiggles the bag, and then suddenly it all drains, and I'm like, well, that's weird.
Yeah.
And I hate them, because I remember when I was a kid, they tried to put one in while I was conscious, because they, if you remember when I said you go through the intensive rounds of chemotherapy before radiation, before they do the transplant, when they give you that chemotherapy, because it's so toxic to the bladder and other organs, they essentially want it out of your system as fast as possible. So they put it in, and they have you connected to like 2 litres of fluid that just pumps through. And so even if, in my case, they had to pump even more in, because they couldn't get the catheter in when I was 13. And so they were basically relying on me to go to the toilet every hour and pee it all out while I was on that one particular chemotherapy, I guess. So same thing here with the heart failure. I had the catheter in. They got the catheter out. That was unpleasant. But I think the scariest thing for me was after I woke up and went to swing my, they're like, oh, physio will be here in an hour or whatever. I'm like, what do I need physio for? Like, just let me out the fucking bed. Physio rocks up, and she's standing beside the bed. She's like, this is going to feel really weird, but you're not going to have the strength to get out of the bed by yourself. So I just want you to, like, hold my hands, pull yourself up. So I hold onto my hands and I pull myself up. And we're sitting on the side of the bed. She's like, alright, slow and steady. Being the good patient that I am, having learnt things over the years, I didn't try to rush it. I did exactly as she said, put my legs out slow and steady. And I went to stand up, and within, like, before I'd even, like, straightened my knees and legs, I was like, this isn't going to happen.
You're weak. You're just really weak.
Yeah, so I learnt afterwards that you lose something like 20% of your muscle mass per day while you're in a coma. He'll hang around until you tell him not to. Come here, buddy. Yeah. So you lose like 20% of your muscle mass per day whilst in a coma.
Oh.
And I think that's like...
You said you were a week.
Yeah, so people think that like being in a coma is the same as sleeping, but it's not, because when you're sleeping you're still moving around and rolling over and moving and stuff, and the muscles are still sort of being used and exercised occasionally. When you're in a coma, you're completely still. You're not doing anything. You don't move. And so everything just, so the body just goes, well, we don't need those anymore.
Okay.
So yeah, it took probably about another 3 months for me to get some strength back, and the biggest problem I've had since then is literally just the heart has never been the same since the heart failure. It just, everything is exhausting. From, like, you go to the toilet and you wipe your bum, that drains you. Walking down the street is okay to some degree, but if you have to walk down a straight street and talk at the same time, you'll be drained in seconds. I can't walk and talk, or talk and eat, or walk and eat at the same time. Like, I have to dedicate literally all my energy to something when I do it, and at times it's like I physically just can't do things, and like there's a particular scene actually very similar in that Stephen Hawking film, the story about his life, where someone in the crowd, I think, drops a pen, and in the back of his mind all he wants to do is, all he pictures himself doing is being a gentleman, walking over, picking up the pen and putting it back on the table for them. And like it clicked because like I've had that same issue like on trams and things, walking down the street, like you see someone drop something or somebody drop some coins in front of you and you just look at it, and like part of me wants to like bend over and pick it up, and I sort of can sometimes, especially these days, but during that time when the heart was really bad, and consequently also at the time my skin was really bad, so the GBH had basically all my skin was like, it was like looking at sunburn. You could peel off big chunks of it. It was a little bit itchy, but it wasn't like sore. People were always like, oh, are you in pain? It's like, no, I'm not in pain, it's just itchy. And so it just looked bad. But it also restricted my ability to like move. Like it was like sort of wearing really thick leathers all the time. Like everything was just tight and heavy and hard to move, and so consequently in doing that, if I'd sort of bent over in those days to help someone pick something up, I would have actually like toppled over and not been able to get myself back up again. So you sort of have to sort of like stand there and be like, I'm sorry, I can't help you. And it feels really bad, like you feel guilty as fuck for it, but there's nothing you can do. And then so on top of that, it's, how did we get there?
Well, after you're recovering after that week, and then the 3 months.
The heart failure.
Heart failure.
Heart failure, yeah.
3 months recovery.
Yeah, and so essentially I joined the McNelly, what I call the McNelly Heart Gang. So my grandfather's had a heart attack, my uncle died from a heart attack, and this is all on Dad's side. And my other uncle had a heart attack.
Yeah.
And I think the third one, I think they've all had heart attacks now, except Dad, and one of them's dead. And Granddad passed away as well a couple of years ago, not due to a heart attack, but he had liver stents and things that failed. And so...
Is what you had considered a heart attack?
No, so I had congestive heart failure in 2014. I have had since a couple of heart attacks. So last year...
That was at 22?
Yep.
That first time?
No, so the heart failure was at 24.
24.
Yep. And then last year, 29, was it 29 or 2018? I think it was 29. Yeah, it was last year, the start of last year, 2019. Yeah.
Yes.
I had my first heart attack.
Oh.
And I spent, was it 5 days at Ballarat base? And they put a stent in one of the lines in the heart. And that was good and well. And then they sent me home with blood thinners and things. Except they didn't send me home with any instructions on how to take which drugs to take and when, because I'm already on like 20 or 30 tablets a day, so they'd sent me home with these new ones. I was a little bit confused, and hindsight then, even at the time, like I was thinking to myself, I really should call up the hospital and clarify this. But I was thinking to myself, I'm seeing my oncologist in a week, I'll just clarify it with him. Like, it's fine. I don't need these drugs can't be that important that it'll matter that much, which was stupid of me at the time. Like, I knew they were, but thought I'd make it a week and be fine, and I didn't, and it was because I didn't know what I was meant to be taking. Again, should have looked it up on it myself, but that's the weird thing. I ended up having a second heart attack a week later, and went back in, explained the situation to one of the nurses, I think the head nurse on one of the floors, a nice guy. I'd met him before a couple of times, I think, actually. And he basically said, yeah, look, Hamish, he was like, it doesn't matter that you could have called or whatever. He was like, it doesn't matter that you know all this and could have done it. He was like, the simple fact of the matter is, if it had been anyone else, they wouldn't have known and wouldn't have called, and we should have told you. Like, it's realistically on us. He was like, we should have told you what you needed to take and when and how and stuff, and you shouldn't have been discharged without that information. So I don't know what the go is there, but anyway, I always sort of feel a little bit responsible for that, even though I'm told it's not.
No.
I guess in a court of law, a lawyer might argue that it was, but I'm not too concerned. I figure, given everything else I've been through, it's not really that big an issue for me. Most people would be like, that's gross negligence, you could have died.
Yeah.
I could have died a lot of times over my life, I don't really care.
Can you tell me what a heart attack feels like?
Hmm?
Can you tell me what a heart attack feels like?
I can tell you what a heart attack feels like, but the tricky thing with heart attacks is the symptoms are varied because of the way the heart functions. The heart is a very inefficient pump. Whoever designed it actually did really terribly. It only pumps on average something like 50 or 60% capacity of its like full load. If you're an athlete or good genetics, whatever, you can sometimes get it up to like 70 and 80, and obviously there's rare exceptions. But generally speaking, 50 to 60% is about its efficiency coefficient, I think, mathematically speaking. I don't know how they figure this stuff out, but they do. Mine was pumping at about 20% during the cardio failure back in 2014, and then we got it back up to about 50, I think, 40, 50, which is about what you need to stay alive. And yeah, so I guess the heart attacks just kind of like go down on that. But I mean, at the same time, like I've also got diabetes now, which they didn't diagnose until I essentially had the first heart attack. They sort of always are like, oh, your sugars are high, your sugars are high, your sugars are high, but they never sort of like looked into it to investigate as to why. And like they just kind of always, I guess, wrote it off as part of the steroids, because the steroids can actually give you diabetes type 1, to be specific. We'll get into that because I'm not really a big fan of the whole type 1, type 2 thing. It's not really how it should be. Diabetes, I guess, sort of contributed to the heart failure in the end without us even knowing, because it had been untreated for so long. And I guess to this day it still kind of is, and people give me shit for it, but really it just sort of comes down to like when you're taking 30 tablets every morning and 20 tablets at night, and then you've got to like check your blood level 5 times a day and inject insulin 5 times a day. There just hits a certain point, days, weeks, months, where you're just like, you know what, fuck it, I don't care. And I've spoken to other people in similar situations to me, and it's the same, it's all around, like, and so I think at the end of the day, and as doctors have often said to me, it's like, I wouldn't worry too much about it. We give you enough of the drugs that we give you to, we sort of factor in a little bit of leeway here and there. So like, people fret about, making sure they take drugs consistently at the right times with, things like the amount of the toxic substances that I take with the labels they have, like, labels like this that say, don't take with this, don't do this, don't do that, don't do this, don't take that, blah, blah, blah. Take it this time with this amount of food. You can ignore pretty much all of them with the exception of the grape juice one.
What's that one?
So, obviously, I guess the really scary thing is that between the period of, I'm going to say, 2012 and 2018, that 6-year period, despite having heart failure in the middle there, I would say I was a raging alcoholic. I was out every weekend, easily consuming a bottle of vodka or more in a night. And the scary thing was keeping it down. I'd never throw it up. It was always down all night. There was not a period in that period where any of it came up. I did have a few incidences. One landed me really drunk on the way home from work one night, and literally work is like at the time work was here, and all I had to do was walk down the street 10 minutes to my house here, and somehow I got lost on the way home. And called Mum in the middle of the night and was like, I don't know where I am, but I think I'm near Sturt Street, someone can come and get me. they spent an hour and a half looking for me before somebody else actually found me, apparently in the middle of the road. And this is near that aged care centre near Sturt Street. There's a retirement village, I don't know, forget the name of the one. Anyway, and one of the nurses there apparently luckily found me and got my phone off me, and yeah, when Dad rang, answered it and said, yeah, look, he's here. So all I remember from that night is sort of passing out in the gutter at one stage. Well, not really passing out, it was more like kneeling down and taking a nap. Which I guess most people would class as passing out. But I distinctly remember laying down and thinking to myself, I'll just lay here for 5. And so, yeah, I guess that's how I made it. But that was fine, because like, I woke up back at home and it was all good. And then probably about 3 years later, I was at a housewarming party with some friends, and I think somebody was there and had challenged me to a drink-off or something, to which I happily obliged, because everybody knew that I could, drink a ton, and it wasn't a surprise. And so they filled up a glass, like, mind you, I was already drunk before I got to the party and stuff, but they filled up another glass of vodka, which I'd happily drink before many times and thought nothing of. But this time I think it was a little bit different. I think this was the start of my decline after the heart stuff and things, and so I drank the entire glass per usual, and then slumped up against the wall. I remember slumping up against the wall after it, and then waking up about 8 hours later in the emergency room, and just sort of like briefly coming to and thinking to myself, oh, this is normal, just going back to sleep, like, because I'd spent so much time in hospital, it was like, didn't even occur to me that I wasn't actually meant to be there today. And so trying to go back to, like, just grabbing the pillow, making myself comfy, go back to sleep, and the doctor's like, Hamish, you awake? I'm like, yeah, what do you want? Do you know where you are? I'm like, emergency? And it's like, oh, that's good. Do you know why? No? Your friends called us. Which wasn't entirely the case. They called one of the people at the party, the person whose party it was actually a nurse anyway, so she knew, her and I go way back, like, we'd been friends for years, so she knew I was fine, but someone else at the party, apparently disagreed and decided I needed an ambulance. And yeah, so, like, she was like, yeah, well, I was just going to leave you on the couch with a bucket and let you sleep it off, because that's what you're doing, but someone else was like, you're not responding, we need to call an ambulance, which is fair. I remember waking up and having a massive pain in my chest, because when the paramedics rock up, they did like that whole, how conscious are you thing, which is fair, I guess, and I registered 1 or something, which is non-responsive, and they do this thing where they, like, rub your chest and it really hurts, and people respond to that usually, but if they don't, then you know. And I just remembered my chest being like, oh fuck, felt like somebody had punched it the next day. Yeah, so I woke up in the hospital, and the doctor's like, Hamish, do you know where you are? I'm like, yeah, I know where I am. And he was like, date, time, name, blah, blah, blah. I did all that. I was like, fine. And then I saw Mum, and I was like, oh, shit. And I was like, I do feel a bit fuzzy. Hang on a minute, I'm meant to be at Bluestone. Why aren't we at Bluestone? Like, that was the last thing I remembered, was we were all heading to Bluestone, and I wasn't there. And then I was like, what's the time? And he's like, 6:30 a.m. I was like, guess lockout's passed then, hey. And it was at that point that the nurse sort of came over, and she started just, like, handing these, like, Beyond Blue cards and depression things to me, which was really funny, because they'd already had to talk with Mum and Dad, like, is he unhappy, is he depressed, is that why he's drinking? And I just looked at her and, like, put up the biggest smile and, like, laughed, because I lost my shit. Like, it was, for me, it was like, no, not even close. Like, it's, like, yeah, I get unhappy and I get depressed, but, like, my way of dealing with unhappiness and depression is not by drinking or killing myself, for example, or anything like that. My way of dealing with unhappiness is just kind of, like, sitting and wallowing in it for a day, and then just sort of, like, analysing it, trying to figure out why, and then once that's done, I'm done. That's it. It's dusted. And, like, like, for me, the binge drinking on the weekend was literally just about being out there with friends and having fun and living life and just kind of enjoying every aspect of it, and I didn't care. And the funny thing was, people were like, it's a problem because my sister used to give me shit for it. She'd be like, you're addicted to it every weekend. I was like, I'm not. And so basically after that, I took it was like a 3 or 4 months break, and then I just went back to casual drinking. And I say casual because I just went back to having one cider here or there at a party, and that was it. And that's essentially what I've done since, really. In fact, I turn up to parties these days quite often. I don't even drink at all. But it's not for me. Alcohol has never tasted good. There's not an alcoholic beverage out there that I would choose over Coke or Red Bull, for example. As far as I'm concerned, they taste better without alcohol. As I said to the nurse, I was like, the only reason I drink is for that high, that feeling when you're around friends, and it has to be with friends. I've never gotten myself into that sort of level of stupidly drunk without anyone around. The only time I'm ever like that is if there's a group of people, and it has to be a group because otherwise why are you doing it? And that was my thing. I just and my doctor knew. He knew I was drinking a lot. I don't make any attempt to hide things. There's no need. I guess when you have 10 years with the doctor, it's just sort of better to tell him exactly what I'm doing, when and how, because that way the drugs and stuff, if something does go wrong, he can analyse completely why. It's hard to get to the bottom of something if you don't know all the details, so I've always sort of kept my doctor well informed of everything I'm doing, even if it's not entirely what he'd like. And I guess, and so other than that, my diet's always been a bit shit, and that's probably the other complication, but I don't drink too heavily these days, and the liver's always been fine. Every time I go down to Melbourne and get tested, that was always the thing I kept an eye on while I was drinking. It's what are my liver results like at the moment, liver and kidney tests, because I was getting them done monthly anyway, so it just sort of made sense to ask, just to be sure. That way if something did start to drop off, I could be preemptive and be right, need to stop drinking. Luckily that never happened, and basically over time I just kind of grew out of it, I guess. And it's just I'm done, I've had my fun. I'm sure I'll probably have my fun a couple more times over the years at certain parties when they come up, but on a regular weekend basis, I'm not actively looking to go out to parties these days. Which is weird because we're not allowed to. So that was sort of the last, 6-8 years of my life, leading up to the heart attacks. I haven't really done any hard partying since the heart attacks, and I don't think I will. I can certainly still drink. I've had a couple of nights here with Dad where we've polished off 2 or 3 bottles of wine together. But it's not. I guess I wouldn't sort of go to a party and drink a bottle of Green Fairy anymore. Anything like that. And I've tried other things, but they don't do anything. I had a friend offer me some MDMA once, and I tried it, and I thought to myself, I'm not feeling anything. I'd rather just drink the alcohol. I don't see the appeal.
You've had so many tablet drugs.
I think so. I actually think that's got a lot to do with it. I think my body has just flooded with so much over the years that everything else nowadays is I don't know, because there's the thing in the liver, and it filters out stuff, and that was what the grapefruit juice was about, actually. It's quite important when you're on as many drugs as I am and stuff, especially in elderly people, that they don't have grapefruit or limes, because there's an enzyme in it that removes or helps make the bioavailability of any other substance that passes through the drug far more available. And so consequently, when doctors give you a tablet and it's got 5 milligrams of something, they may only be intending for 1 milligram to actually make it into your system and do what it needs to do. The other 4 milligrams they're expecting to go into the liver and get passed out through everything else. So when you when you have grapefruit juice, the ability for the liver to actually process things and make the body to process things and make use of them becomes a lot higher, and so consequently, instead of only absorbing 1 milligram of something, you might end up absorbing the whole 5, and that can lead to overdoses.
Oh, wow. Okay.
So yeah, and we learnt that when I was 13 because we used to turn up to my old doctor at the children's hospital, Dr. Waters, and get the weekly blood tests to monitor the cyclosporin level, which is the key drug in immunosuppression in my case, and is highly toxic, and so they have to get the level right at the start, and they do that by monitoring it, and then after that they know if it's out based on symptoms basically. But to get it right to start with, they monitor it, and he said, your level's fluctuating every week, it shouldn't be doing that. He was like, you're not taking the drugs or what? And Mum and Dad were like, no, he's definitely taking the drugs every morning, we're on it. And so I think after the second or third week, he was sort of getting a little bit sort of annoyed, because he was like, well, you say you're taking the drugs, but the papers are saying you're not, and, so he's sort of stuck in a catch-22. And it was then that the pharmacy started putting labels on the box, don't eat grapefruit juice, and I was like, oh. Because I'd been having massive grapefruit cravings all through my childhood treatment with cancer.
Oh, nice.
Which was kind of weird.
Yes.
Yeah. Anyway, so, yeah, I guess that's where we're at. I've had 2 heart attacks, 2 rounds with cancer, heart failure. I've had pneumonia a couple of times, i.e. the lung chesty thing. I didn't mention it because it's not really that important on the grand scheme of things, even though most people like COVID pneumonia at the moment. I'm like, I've been there, done that.
Yes.
We had a little bit of a COVID scare at the start of the year, but I got lucky and I didn't have COVID, but I still had to stay on the COVID ward, which, to be honest, is really nice. There's nothing better than having a private room to yourself with your own bedroom in the hospital. The scary thing is getting back out as an immunocompromised patient. You sort of have to walk down the corridors and stuff, and I'm like, don't touch me!
No, don't touch me. Don't breathe on me.
But yeah, so here we are, 12 months later, I'm still alive, so definitely didn't have COVID. Yeah, it's tricky. Like, my girlfriend at the moment, for example, she lives over in Warragul.
Can you tell me how you met?
We met through Peter Mac at On Track, probably about 5-6 years ago, but we only started dating this year right at the start.
Okay.
And so consequently, her, for example, she's a bit more... she's only done... I say she's only done, but it's a different story. So she's only had cancer once, but that said, I think right off the bat, she sort of got it as bad as I did, like with the GVH and stuff, after the first time round. So she sort of experienced what it's like anyway. But I mean, like, that's the thing. So she got it a lot later in life. I think she was like 21 or 20. I think she was 21 when she got it. 21 or 22. I can't quite remember. Yeah, so I guess it's a bit different. Like, I sort of grew up with it, whereas she's had to adapt to it. But yeah, that's just the differences. But she's a lot more cautious, I guess, around infection risk and things. And to a degree, it's probably necessary. She's not on the same drugs that I'm on, and it does appear that, like, to me it appears that she's a little bit more susceptible to infection than I was, or have been. Like, I'm constantly getting chesty infections all the time, and it scares the shit out of me at the moment, because every time I cough I'm like, shit, do I have COVID? And I sort of have to, like, because I don't want to be running down to emergency every time I have a cough, because that puts me at risk more. And if it's not COVID, then there's no point. It's a waste of time, blah, blah, blah. I have to spend 4 weeks isolating for no reason. So essentially I just sit around and give it a couple of days every time I get a cough. And see, that's the thing, like, I've actually always got a cough, just from the years of treatment and pneumonia and stuff. So really what I have to do is not so much do anything about the cough as keep an eye on what it's bringing up and where it's coming from. So when you live with a cough, it actually becomes very easy to tell whether the cough is coming from, like, your lungs, your heart, or the back of your throat. And people are always like, what do you mean your heart? How does your heart make you cough? It's very simple. When your lungs aren't getting enough oxygen and stuff, you get this almost like itchy sensation. You start breathing, and it sort of feels like it's here, but it spreads down here, and you sort of cough, and it's from the lungs. And it's just because like the heart isn't pumping enough oxygen through the thing, so the diaphragm and lungs cause a cough to sort of bring in more air and whatnot. I don't know how it works, but yeah, basically the cough is designed sort of like the same way yawning is, to get that oxygen in fast. And yeah, so I keep an eye on that, and that makes it easy for me. I mean, I've been doing that for years, so I sort of always know. One of the easiest signs is always the snot and the phlegm. As soon as it sort of goes from like clear or opaque to like a green or a yellow, that's when you need to be concerned. When it's yellow, you need to be worried. When it's green, it's time to go to hospital. And I mean, like I take 2 antibiotics, an antifungal, and an antiviral on a weekly basis. And antiviral sounds weird because you don't really have anything that is capable of beating viruses, but it's considered an antiviral because it's sort of like, I guess, boosts the body's ability to fight off viruses to some degree. Pretty common drug. They use it for AIDS patients and lots of other things. And I think they use it to treat herpes and stuff as well. That was while we're on the subject of drugs, all the drugs that I take, I have listed in the back of my head right down to the milligrams, how often I take them, their drug names, possible other counterparts, and like all that. And it always, you go into like emergency or something and they want like a list of drugs and they've got like 2 rows to write down the drugs, which is fine. And I tell the nurse, I'm always like, yeah, you're going to need a big list. She's like, no, just get some notepad. But then I start listing them and she's like, where are you reading those? I'm like, my head. She's like, I've never met a patient who knows all their drugs that well. Like, it's just, I didn't actively go looking or teaching or anything like that. It's literally just from years of like staring at the box name, putting it back, staring at the box name, putting it back. Like I've just picked it up. Like it wasn't like I planned it or went out of my way.
You didn't study it.
It just happened.
Oh, gosh.
Yeah. Yeah, so there's a long list of drugs there, and obviously COVID's been a bit shit this year, but aside from the pneumonia and stuff, like, and the heart attacks, and the hearing loss, the no hair, the skin's pretty shit. I mean, when my skin was a little bit better, that's when I got the tattoos done. Even though the doctor, again, when he was like, I really don't think you should, it could flare up your GVH, or your GVH might attack them, you might get an infection.
How long have you had them then?
So I got this one first,
yeah.
Which is a symbol for immortality in, like, I guess Viking. I say Viking. When I originally got it, it was because I'd seen it in, like, a online as part of, like, a Norwegian, Slovakian sort of symbols. Like, I'd sort of deliberately Googled protective symbols for, like, Norway and sort of that area. And it wasn't until the Vikings TV show came out a couple of years later that suddenly you sort of started seeing this one and this one appear like everywhere across the board. Which doesn't bother me because I figure, well, they still mean the same thing, so I don't care if everyone's got them. So this one means immortality, and it's called I think the English translation is Helm of War, and then this one is, I don't know the English translation, but in Swedish, I think they call it a Vägvisor, I don't know how you say Swedish words, but it's got a really fancy name. And it's essentially what they used to do is they used to paint that one up on their sails, on their ships before they'd go out into like foggy areas, and the idea was that would sort of be like a compass and guide them through the fog.
And these ones?
And then this one's sort of partially my own design, so it's the Eye of Ra, or actually technically it's the Eye of Horus. Wait. I think that's right. I think it's Horus. Eye of Horus, technically. Ra took it from Horus. And then just the Pokemon, Mew. Because he was always my favourite as a kid, so I had my tattoo artist figure out a way to incorporate that in there. So I was going to get some more eventually, and they're all going to have sort of like, I guess, hidden things, sort of like Where's Waldo? find the pop culture reference in the tattoo art.
Yeah.
I don't know. And then the others are sort of courage, fear, and then these ones were just two keys symbolising, I guess, the keys to space and time, or if you're religious, the keys to heaven, whatever you want. Yeah, double meanings.
Yeah.
And I was sort of the first one was really funny because I got that, and Mum's always been like absolutely against tattoos, which is funny because now Charlotte and I are both covered in them. It's almost like Mum says no, let's do it. But yeah, I rocked up home with this one first, and it's covered in the Glad wrap with the stuff, and Charlotte's like, so you might want to see the ink on Hamish's hand, Sandy. And she's like, doesn't have ink. You wouldn't be that stupid. I walk over and she's like laying on the couch, and I'm just like, yeah, it looks pretty good. And she's like, no, that's fake. And I go and stand over by the fire, and I'm like, whatever, that's fine by me, I don't care. I'm like, that's cool. And Charlotte just sort of pipes up again off the couch. She's like, might want to check again. And she's like, come over here. And she like takes a closer look, and she like can see the skin's like broken and pinpricked, and she's like, not happy.
Not happy.
And then I think I went and got a couple more, and that was when she was like, right, don't touch your right hand. So I made an agreement with her. I was like, alright, I won't touch my right hand. I think she was mostly just annoyed that, I got it like right on top of my hand, in a very visible spot. Yeah. And as I said to her at the time, I was like, because I'd already lost the jobs and things that I'd been, well, not so much lost, but, I wasn't working. I was sort of dropping in and out of uni again, and I've done a lot of uni over the years in various courses.
What kind of things?
And I just kind of, I was like, you know what, it doesn't really matter, because at the end of the day, I'm not going to get a job. And if I do, it's not going to be the sort of job where having a tattoo on my hand is going to matter. So I just sort of figured, it doesn't matter. Like, it's not an issue. And if it is, I'll deal with it later. But yeah, I've done a fair bit of uni, so, obviously everybody's intelligent. I like to think I'm a little bit more intelligent than the average human being, but I think everybody does, so it doesn't really count. I guess, so after high school, because I didn't actually technically finish, I did year 11 and year 12, and I finished year 12, but I didn't get I didn't finish enough units to actually graduate, I guess, technically, is the problem there. And that's just because of, I guess that was a combination of the cancer and just my own sort of laziness, I guess. Like, I have a very lazy personality, although it sort of depends what it is, I guess. I can be motivated to do things for, like, very short periods of time or long periods of time, I guess, like, consistently, but it's sort of hard for me to, like, motivate myself to do stuff. The hardest thing for me at the moment really is actually just getting out of bed every morning. And it's not because, like, I'm depressed or unhappy, it's just, like, if I get out of bed, what am I going to do? Like, well,
so what kind of courses did you just study?
So immediately out of high school, I did IT, and I did, it was a general IT course, which I dropped out of almost 3 weeks into, essentially because I was having relationship issues at the time, with my first girlfriend. And then probably about a year, 2 years after that, a mate and I signed up to do the Bachelor of Engineering, Diploma of Engineering, and we stuck that out for I think about 6 or 7 months together. But in the end, I was like, because I didn't have a car at the time, and he'd lost his license, so it was me basically driving his car and us to uni every day, or vice versa. And as good as that was, like, I didn't have. It was before the heart failure, but my skin and, like, muscles had started to break down, and engineering was like at the top, and it was a lot of walking all the time, and essentially it just got to me, and every day I was like, it was like trying to pull myself out of bed like now, except only I had to force myself to go to uni on top of that, and it just wasn't happening. So after about 6 or 7 months, I think we both sort of started missing 1 or 2 classes here, and then by the end of the year we were like, this isn't going to work, we're not going to finish this, so we dropped out. But you'd be amazed the amount of things you can learn about steel in 6 months. We were blown away. Like, engineering's a crazy subject. The maths aside, like, the stuff you can learn about, like, metals and just the way forces are applied and stuff, it's insane. Like, things you don't even think about on a daily basis. And then after that, about a year, 2 years ago now, 2, 3 years ago, 2015, I think. Maybe, no, that doesn't sound right. Maybe it was, I don't know. Might have been 2015. Yeah, I did an online gaming course, so it was sort of developed towards game design, like video game design, computer game design, and I did that. I stuck that out for about 12 months, I think, or longer. The problem was it was an online course, and the teachers and instructors kept changing all the time, and they actually ended up, I think it was like Open Universities Australia or whatever, I think they ended up getting like sued and stuff for things. Luckily I got all my money back anyway, because I put through a claim and essentially said, look, this is ridiculous, blah blah blah, and they were like, yeah, okay. I don't know, they put all my HECS back, so it wasn't an issue. Which then allowed me to go back to university and try and do, like, when I say back to university, I mean back to a campus. So I went back up to University of Ballarat, and basically started doing the IT course again that I'd started years and years and years ago. So I've always sort of had an interest in, I guess, like, technology and science, I guess, or technology and physics and, I don't know, that sort of thing. But IT specifically, IT for me is like, it's like second nature, I guess. Like, I'm no computer programmer, like my friend now is, like, because he went back and did IT as well, but he's finished it and now working at IBM. Like, I don't have the same level of, like, programming skill and stuff as him, but, like, if you gave me the pieces to a computer, I could build it and get it operating in, like, a day. Same vice versa with a lot of things, I guess, but yeah, anyway. So I did that for 12 months, but then, unfortunately, the University of Ballarat had similar problems to OUA, but for different reasons. One of the teachers was just shocking, and, like, despite us, the class as a whole, handing in the work and stuff, and then him sending it back and fixing it, it got to a point where he just was never clear about what needed to actually be done. And so there was, like, several assignments that were due, but there was, like, no sort of laid out groundwork for what we actually needed to be presenting to him, and he used to just bring in this, like, robot vacuum cleaner every week, which was somehow related to what we were doing, and he'd have us all pull it apart and figure out how it was working. And it was just kind of like, why are we doing this? Like, what are we meant to be doing here? And, like, it ended up being that he wanted us to write up, plan out and write up documentation for a project where we were going to use a rover on Mars to look for a lost ring that Neil Armstrong had dropped on Mars. Like, what relevance does that have to an auto-driving vacuum cleaner? I mean, I get it, it does things like the rover does, but, like, why do we need to pull it apart to figure that out? Like, we could have just Googled it and we know how it works.
Not a very good teacher.
Yeah. Anyway, and so after a few complaints and things, he actually got, I don't know if he was let go, rearranged, I think is the term the university likes to use. We shift the teachers around a bit. But by that stage it was too late. It was like the end of the year and none of the work had been done, and they were like, yeah, we need you to come back next year and, you know, just finish these things and stuff. And, like, I was in the middle of, I think, shifting back home, And something else was happening physiologically. Something's always happening. Like, as soon as life gets going for me, something health-wise kicks in. It's like, yeah, no, you need to take a step back. Something happened, and I basically said no yet again. And so I've got probably 3 or 4 courses unfinished at the moment. That was 2 or 3 years ago. So yeah, and then that's basically that's the extent of my education career. Any other education I've taken on board is through YouTube, Google, friends, books, and my own thinking, I guess. Life will teach you a lot more than school.
Yes.
But nobody ever accepts it. Doesn't mean anything.
Don't get a qualification for it.
Yeah, there should be a life qualification. I excel at life studies.
Yeah. Yes. Well, there's a couple of questions here that I'll ask you, but you kind of already told me.
Yep.
Life changing. Has your life turned out the way you thought it would when you were young?
Yeah, that's a tricky one because
you kind of. Well,
my life changed while I was young, so I was kind of lucky in that sense.
Is there an incident that changed you permanently? Altered your future? Yeah,
there's a few incidences that have changed me permanently, and I wouldn't say physically. My mental, I guess, my psychological state, I would say, took some shifts. Several key moments in my life. I think the first one was the first time round with cancer, like finding out that you've got it and dealing with it, just as a whole, like that period. That was probably where I took my first mental shift, and I would say my personality from primary school age me to teenage me, I guess most people take a big personality shift. But for me, the biggest shift was more sort of that nothing else matters anymore sort of approach to life. Like, it's not that it's hard to explain to people. Like when I say, and people are worrying about money and COVID and all the rest of it, and I'm like, the most important thing you have in life is your life. That's all you need to worry about. Nothing else is important, right? And they don't sort of fully grasp what I mean. They're like, oh, but you need money and stuff. I'm like, no. Your life is the most important thing. Past that, it's time. You want to get as much time as you can on this planet before kicking the bucket. That's the life goal. End of story. Right? What you choose to do in between doesn't matter. You can be sad, happy. That's all part of the journey. And I guess, like, for me, that sort of became really apparent at a young age that, money and everything else, like, yeah, they're important, they're good, they're nice to have. Like, don't get me wrong, when people say money doesn't buy happiness, I'm going to have to really disagree there on so many levels. Because whilst money can't buy happiness, you can buy gifts for other people that make them happy, that make you happy. And there's ways you can spend money that will bring up your happiness. That's just a fact. Like, if you donate lots of money and stuff and you like the feeling of donating money to charities, that will make you happy. And then there's other things, like, sure, it doesn't bring fulfillment and happiness, but it does bring you a comfortable life or a comfortable lifestyle. So money is important, but it's not critical to happiness. And I would say it's not critical to, like, just enjoying life in general. You don't need money to have a good life. But I think a lot of people get hung up on a lot of things these days.
If you had to live your life again, what would you change?
Yeah, I've answered this a million times. Nothing. There isn't anything I would change. People often ask, if you could go back and not have cancer, would you go back and not have cancer? And I've always said no, I'd keep the cancer. 9 times out of 10, both times I would keep the cancer. I'd like to not have the heart attacks if possible, and the heart failure, they're a bit shit. The GVH has been a bit crap. And if I could get something back, just one thing, I've always said it would be like my eyes and skin, physical appearance. I don't care about my actual health. Like, if I could get one thing back this time around, it would literally just be my physical appearance. And that's just so I can walk down the street without, standing out. And it's not even standing out. Like, I don't care that people know or look at me or anything like that. It's more just kind of, I just want to be able to, see the world without the world seeing me. If that makes sense. Like, I sort of want to be able to observe it from the unbiased opinion of, why is he sitting there looking at us?
What is the best piece of advice you were ever given?
There's only one piece of advice I'd ever give, and that's, don't ever ask for permission to do something. You're far better off asking for forgiveness afterwards if you fuck up. That's not to say that you should go out and do stupid things, just that if you do something and you realise it was stupid, just remember it's better to ask for forgiveness for it than to not have done it at all. Because at the end of the day, when you look back and reflect on your entire life, it's not the things that you did to anyone in particular, or the things you did do, just in general, like living life. Like, you're not going to regret the things you did do. At the end of your life, you'll always regret the things you haven't done, or stuff you haven't achieved. Like, there is a list a mile long of things that I can't do now, due to the health, my health, that I'd really like to be able to do, but it's just physically it's not possible. And even if it was possible, it'd just be too big a risk. So yeah, ask forgiveness, not permission. And try to get out and do as much as you can before you get old.
What is the biggest risk that you ever took in your life?
Biggest risk I've ever taken in my life? Yeah, that's hard, see, because I'm looking at that from a mathematical probability. How likely was I to die in this scenario and this scenario and this scenario? So I'm trying to get to the bottom. But look, biggest life, death, risk, stupid thing I've ever done in my life. Okay. Probably walking to the edge of the cliff at Portsea a couple of years ago, knowing full well the likelihood that, a cliff like that could drop away and I could fall 100 metres to my death on the sharp rocks and ocean below. I walked to the edge of the cliff with my phone, leant over backwards and took a photo. Also while listening to Mum, who is absolutely terrified of heights as is, screaming from the fence line, "Get back here!" And me just kind of laughing and still sort of just doing it anyway, because, you only live once. Yeah, that's probably the stupidest, riskiest thing I've ever done in my life. Which is really out there, actually, because there's not many others that I've really done. I've done a lot of, silly things over my life, but nothing that would have landed me in real serious trouble, I don't think.
What are you most proud of?
Proud of? I don't think I actually have an answer.
Are you optimistic about the future of the planet?
I'm, generally speaking, what I would call, and some friends would call, a realist. Mm-hmm. A lot of people say I'm negative. A lot of people in the past used to say I'm incredibly positive, mm-hmm. and a lot of people will still tell you I'm incredibly positive. Mm-hmm. But as I said, I don't think I'm positive or negative. I think I'm more of a realist. So my realistic expectations for the planet, on the positive outcome, I don't know, I think the planet's in for it. I mean, depends which aspect. I think Earth, the planet, Gaia, whatever you want to call it, itself, Mother Nature, I think will look after itself one way or another. It always has, regardless of what mankind does or does not do. If it gets unhappy with us, we'll get the boot. It'll have an ice age, do whatever it needs to do. It'll come back around in 1 billion years and give no shits. As for humanity and whether or not we're still here when that happens, I don't know. I think humanity's got a lot of potential. It's got a lot of flaws, and a lot of them could be very easily fixed. It's hard too, because, like, again, being a realist and a logical person and a bit sort of sciencey, I'm always sort of looking for, like, I guess, answers and solutions. And, like, I see something, and that's the hardest part for me. Like, I see an answer or a solution, and, like, it's doable. But the hardest thing is, like, for me to explain that to someone else. Like, when I explain things, they tend to come out a little bit convoluted, complicated, and sometimes people sort of see like an argument or a point in it that I'm not trying to make. For example, like, you know, Dad, for example, is very opinionated about Black Lives Matter, and me and my sister aren't, for example. Like, we just don't care. And it's not that we don't care, it's more, like, Black Lives Matter, White Lives Matter. I don't want to say Black Lives Matter, but I also don't want to say All Lives Matter, because I think both statements are wrong, and I also think any statement along the lines of White Lives Matter is wrong, because the way I see it, like, the Black Lives Matter protests needed to happen. They needed to happen for a small period of time to make the note that it was happening. But I think the problem now, and a lot of the problem with a lot of these minorities and small groups of people, is that the more you sort of, like, push your point and your facts, the more you push them, the more you tend to push other people away, even if they're correct. Like, you could say to someone who didn't know that 1 + 1 = 2, and that's just a fact. It's been mathematically proven time and time again. You take one, you get another one, it equals 2. But when you do that and you force that in someone's face like that and tell them that it's fact, all you're going to do is make them think, no, that's not true, and I'll prove it. And that's literally part of human nature. Like, that's a thing of human nature. Like, if you're presented with something and you disagree, and someone gives you fact, you will automatically try to prove that you're right and they're wrong. So yeah, I think the only way for, like, all the races to get along is not to acknowledge each other, but rather just to stop acknowledging each other altogether. We just need to pretend like it's not, like, not pretend, we need to just, it's not there, it just needs to disappear. Yeah. When we speak to someone, it's not like, you know, I'm going to go down to 7-Eleven and get that yummy donut off that Indian guy. It should just be, I'm going down to 7-Eleven to get that donut from that guy. So yeah, and I mean, I guess that's what they're trying to say too, but by saying Black Lives Matter over that, it sort of takes away from their arguments and things, and I think it just pushes everyone else further against it, which is sad, because it's the opposite effect of what we're trying to have. But that's just that one thing, so I guess that would be something I've learnt. What was the original question?
Optimistic about the future.
Optimistic about the future, yeah, that's right, and humanity. So yeah, I'm optimistic that humanity will sort that out eventually. Yeah. I don't know whose lifetime it'll happen in, or if it'll happen at all, but I think they will.
Do you think humans will live on another planet or in space stations?
Yeah, definitely. We're already heading there now. I think since the beginning of, you know, the space age, we've dreamt of that. And frankly, we've got the technology to do it now. All we need now is a reason. Currently, the only reason to go and live on another planet, aside from, I mean, some people would argue climate change, but that's not a reason yet. And overpopulation, again, not really a driving reason yet. Both potentially very good reasons in the future to do so, and both reasons we should be actively looking to do so now to prevent that, but they're not the reason we haven't done it yet. I think the reason we haven't colonized other planets and stuff yet is literally just the cost of getting materials and stuff into space. And as old mate Tesla's working on that, I think we'll be fine anyway. So yeah, I think, and I mean, every video game you play these days is always like multiple planets. TV shows always center around civilization on other planets and things. So yeah, the fact that we've dreamt it for so long, and we already have plans to do it and the means by which to do it, I think it's just a matter of time.
Do you think there will be another world war?
Depends on your definition of world war.
Well, it doesn't have to be the traditional way.
I think there will be some more massive conflicts involving humanity versus humanity. And I think that will go on for quite a while. And I'm actually not so sure that that's a bad thing. I think conflict in the way that humanity does, like the fact that we have arguments, disagreements, and that they do escalate into violent, tragic things. I think everything has its place. So, for example, war always seems to bring out radical advancements in technology and science, just because of the sheer amount of money that gets pumped into it as a result of that. And yeah, there could be other things we could pump that money into and, you know, could work and stuff, but like, on a base level, we fight and have a difference of opinion because that's sort of how you evolve. Like, you know, a species doesn't evolve by agreeing to disagree. A species evolves by finding the better solution and then oppressing the worse one. So, whether that's, I mean, it's tragic and it's bad, but it's also how evolution works. You know, the stronger survive. And the worst part about that is every time I think about that, I think to myself, yeah, you had cancer, you'd be one of the dead ones. I'm okay with that. Like, yeah, I was genetically flawed, I wouldn't have made it, and that's the way I think to some degree life works and life should be. And science, you know, people keep saying, oh yeah, but we've got science and so we've figured out ways to like better that and be better than that. And part of me is just like, yeah, but we haven't figured out how to make it like a permanent thing. So it's sort of like you fix one thing and then evolution comes up with another one that now you need to fix. Like, just let evolution do its thing and kill you off. Then it won't bring up another one. Every time you fix one problem, evolution's like, right, we need another one.
What do you think life will be like in 100 years?
Much the same, I'd say, but technology and stuff will be vastly different. But I'd say life will be the same. Unless something radical happens and we develop, I mean, like, we're talking like a great shift, so I guess that's the thing. We talk about like advanced civilizations and stuff, so I think short of us becoming like, you know, a type, what is it, 1? I think we're at type 0, I can't remember. Short of us becoming like type 1 or type 2 civilization or whatever it is, or any other type, I think short of that, life on Earth won't actually change. There need to be like a big shift in something for life to change. Otherwise it'll continue as is. Same problems, same people, different places.
Alright, we're up to my last bit, which is final comments, words, messages.
Final comments. Final comments, yeah, I guess just everything I've spoken about is really kind of my treatment related and stuff, but like, yeah, I mean, I'd say if a bus hit me tomorrow, I'd get up to heaven and say I had a good life. wasn't bad. Wasn't spectacular. Like, you know, I wasn't a billionaire. That could be good. But no, I've had a good life. I've lived it happy. I've done the things mostly that I've wanted to do. With various help from others. Many and far between. Too many to name. But yeah, I guess really wouldn't be here if not for family and friends. Specifically family. Mum, Dad, Charlotte, Angus. Sort of always had my back right from the start. And I guess close friends as well. Yeah, that's probably about it. What was the other one?
Final comments, words or messages?
Words of wisdom. Well, there was the don't ask permission, just ask for forgiveness. My other one would be, live life with no regrets. But that's everybody's thing. But it's more sort of along the lines of, you're going to die with regrets anyway. Make sure they're things that you regret doing rather than not doing, I guess. And make sure you do everything you can, even if you regret it later. It's better to regret it later than not do it at all. And I guess the other only thing I would really say is that everybody is capable of anything. You don't have to stay in high school to go to uni. You don't have to get a good VCE score, HSC, whatever you want to call it in this day and age. You don't have to get a good score or anything like that to be qualified at something in life. You can go out and be whatever you want to be at whatever time in life you decide to be. And it's never too late to change. I've got plenty of friends that are like 30 now, and they're like, I don't want to do this anymore, I want to change career. And I'm always thinking to myself, so why don't you just go back to uni and get another degree and be done with it? Like, just do it. Like, stop thinking about it. It takes you another 3 years, you'll be 33, la-di-da. You've got 50, 60 years left, which I guess is the other thing for me. Like, I've always sort of gauged my life. When I was 13, I thought I wasn't going to live past 6 months. Because that's what they basically told me. They said, you're a dead boy. That's not what they said. They said it was like, I don't know, Mum always says it was like 80-20 or something like that. I don't know. I'd like to think it was 50-50 chance of survival. I don't really know. And I guess it gets less with the second round, which I knew. But yeah, 10 years ago I didn't think I was going to make it to 30. 5 years ago I didn't think I was going to make it to 35. Now I'm thinking if I'm really lucky I might make it to 40. So you just don't know. I mean, that's me being a realist. Like, some people see that as me being a negative. That's not. That's just me being realistic with my own judgment on my health, like, at any one time. And I think that's what doctors do too. They're always when you ask a doctor, like, even after I've known my doctor for 12 years now and been through everything I've been through, every time I throw him the hardball about what he thinks my life expectancy is likely to be, it's not that he doesn't answer it, it's more just that he kind of very strategically avoids giving a direct number or answer. It's always a sort of dodge, duck and weave. He doesn't want to make the call, and I don't blame him now. These days I completely understand, because it can change at any point in time. Like, it can go from 5 years one day to 3 the next in the blink of an eye, just based on one thing. Yeah. So yeah, I guess that's why the COVID thing hasn't bothered me too much, and I'm still happy to go out in public all the time, pick up groceries and stuff, all the rest of it, because at the end of the day, something's going to kill me, and I haven't got COVID yet, or any of the other viruses and infections that are out there, and there's things out there worse than COVID by 1.5 miles that you can pick up just off the ground any day of the week. So, frankly, catching COVID doesn't bother me. At least it's a known quantity. Yeah, I guess that's really kind of it. Don't live in fear. Live with a little bit of fear, because fear is a little bit healthy. Like when I ride my motorcycle, for example, that's scary. It should be, because if it's not, then you're going to be an idiot. But yeah, just don't be afraid to try new things, especially when it comes to food. Nothing annoys me more than people that aren't willing to try foods. It's like, just stick it in your mouth and taste it. You might like it. Yeah, that's probably about it. I ain't got much more.
Very good, thank you very much.